Good morning. As our last few folks kind of grab their seats, we expect some more people to be joining us. We're really pleased to have people coming from all over the state today. So there will be folks sort of arriving at different points in our agenda. My name is Michelle Miller. I'm the Public Policy Liaison at Missouri Foundation for Health. And I'm here just to provide some general housekeeping points to make sure that your stay with us today is pleasant and that you can focus on learning and networking. We are aware that it's a bit crisp in this room. It's going to keep us all awake, and we have asked that maybe it changed, and I think we have someone working on that magic right now. So hopefully you'll have warm coffee and tea to keep you comfortable. But this is the African American and Hispanic Health Equity in Missouri Forum, and I am pleased to welcome all of you as guests and welcome our speakers today. On our housekeeping items, we do ask that these lovely devices that keep us connected to the world, if you'd go ahead and silence those ringers. So switch them over to vibrate. We understand some of us need to be available throughout the day, especially some of our healthcare providers. We want you to be available to those that you serve, but do please turn those to silent or vibrate. For those of you that would like to engage in the event, in this event on Twitter, we encourage you to do that. We've included at your table a list of all of our speakers who tweet. Accounts that reach them or their organizations are listed right in front of you. You'll also find in your stack of materials that on the participant list, for those that are active on Twitter, we've included their Twitter handle. If you would like to use the Wi-Fi here to be active on Twitter, of course, not to check email or anything like that, but to be active on Twitter, it's the AT&T Wi-Fi network, and the password, any guesses with our proximity to the university? It's Tigers with an S, Tigers, Tigers. So please make good use of that Wi-Fi. Other items, restrooms are just out the doors and down the hall this direction. Make a little hairpin turn and you'll find them. And we will be enjoying lunch sort of halfway through our agenda today. So in front of you, let me just walk through the materials that you have. In addition to our day's agenda, you'll find a purple evaluation form, always seeking new data, learning and growing. So we'd like your feedback on that as we go along. There's a list of more thorough speaker bios, so you can know a little bit more about the folks that are joining us today. We'll briefly introduce each of them, but we wanted to make sure to give full credit to their rich experience, and that's available in that handout. This is an event focused on networking as well as learning, and so we want you to have a chance to get to know folks from a variety of sectors and parts of the state working on these issues, and so we've included a pretty comprehensive registrant list, and that's for your use to continue the conversation after the event. And then you'll find two handouts, Equity Collaborative, which you'll hear lots from the Missouri Foundation for Health. A data book released last year on LGBT health disparities, and then two data books that today is the official release. You are the first people to receive them, aside from the board of directors. Missouri Foundation for Health, so they are focused on African American and Hispanic health disparities in Missouri. So with that, I'm going to introduce our morning speakers. We're joined by Ryan Barker, who will be discussing quantitative data. He is my boss at the foundation and is vice president of the health policy area. He's been at the foundation for more than a decade, so he's really helped shape the health policy team and what we do, and has been a leader and focused on health policy and health system research, like the data he'll be discussing today. So feel free to send those very hard questions about the trending data over the last decade to Ryan. Shannon Canfield also joins us. She's going to be sharing information about some very interesting qualitative research that she's been leading up. She's been our partner in planning today's event. We're very grateful to her and her team. And is really a perfect host for us here at the university. She's received all of her education here and continues to work at University of Missouri on a variety of projects. She is currently project director for several efforts through the Center for Health Policy, which include the Missouri Health Equity Collaborative, which she will discuss in detail later. So I'm going to invite Ryan to the panel and pull up some new information, and we will get going.
Thank you, Michelle. Good morning. Thank you all for being here. It is an exciting time, and we think the information we have to share today is really interesting and useful, and we hope that you will find value in the presentation. So I was going to make a joke about turn to page 1. We're going to start walking through the books. We're not walking through these entire books. There is a lot of really great information in both of these books. If you have seen the past data books, you'll notice that the African American data book is significantly thicker this time. We have some new sections and a lot of new and interesting data that is available for the first time. So let me start out by saying, one, I have a son who turns 14 tomorrow, who has informed me that I am neither cool enough nor funny enough to be on Twitter. So while Michelle can put my name next to that Twitter feed, I have never tweeted it in my life. But let me start out by introducing the foundation. So the Missouri Foundation for Health, if you are not familiar with the foundation, we are a nonprofit private foundation. We serve 85 counties in the state of Missouri. Most of what we do is grant making. We have a new strategic plan that I actually am going to sort of introduce parts of it during the presentation because it actually is very responsive to some of the data that we see in the data books. And then we do have a health policy area of the foundation that I have been blessed, and I say that it's not often nowadays, other than my father who's been at the same job for 45 years, that people stay at jobs for over a decade. I love working at the foundation. I love working in policy. And it really is most days a joy to come to work. So we do work in the policy area, and health equity has been one of our focuses from the very beginning. The foundation feels very strongly about disparities, that they do persist, and that we need to address them and acknowledge them, that it is unacceptable that access to and the quality of health care that Missourians receive is dependent on the color of their skin, on what zip code they live in, on their sexual orientation, their gender, or their income. And that we, as many people who work in public health or in healthcare settings, need to work to address these issues. So I'm going to go ahead and just jump right into the presentation and start out with a little bit of background information. This is the third set of data books that we have produced. The first ones were released in 2006, and then a second set in 2009, where we were on a 3-year track. But a lot of the data that came from the new African American data book came from the Missouri County level study, and we waited a little bit for that data because we wanted to include it, and so that's why you see this coming out in 2013. I need to acknowledge that these data books were produced by the Department of Health and Senior Services. Both Rashmi and Andy are in the room, I think. Raise your hands and wave. Rashmi's here. So they produced this, the department produced the data, and then Akisa Coleman, who's one of my staff, wave Akisa, was responsible for going through these data books, editing, asking questions of the state, and making them sort of with some help from our graphic designer into the gorgeous publications that they are. So I wanted to thank and acknowledge both of them. Also at your table, as Michelle mentioned, is a data book in our health equity series that was released last year on LGBT health disparities. And that has actually gotten a lot of attention around the state. Mildly controversial for a state like Missouri to even talk about this stuff, but we felt like it was really important to acknowledge that disparities happen and occur to all sorts of different Missourians, and that we need to acknowledge and work on those. So to start out, a little bit of background information, and this can be found in the data books, but currently in Missouri there's about 735,000 African Americans. That's 12.3% of the population. Missouri's population is currently a little over 6 million. 78% of African Americans in the state live in 3 counties, St. Louis City, St. Louis County, and Jackson County. And 50% of St. Louis City, which has a population around 300,000, 50% are African American. Compared to the US, Missouri is very similar in terms of percentage of African Americans. Nationally, 13.6% of our population is African American, and in Missouri it's 12.3%. Hispanics, about 212,000 Hispanics live in the state of Missouri. That's about 3.5% of the population. And I will stop here because it's one of the things that immediately in the Hispanic data books is acknowledged, that the data for the Hispanic population is rough. There is a lot of undercounting of Hispanics in the state. It affects the data. It affects the data coming from our healthcare systems. And so we want to acknowledge that this number is probably low, is most definitely low. And we'll talk a little bit more about how that undercounting comes into play, especially things like death rates. And while you'll notice in the Hispanic data book that the cover sheet for that section actually says we don't do death rates for Hispanics because of the data. And we use a different way of calculating that. But however, the Hispanic population, while absolute numbers are relatively small, about 3.5%, it is the fastest growing population in the state of Missouri. So since from 2000 to 2010, we saw an 80% growth in the Hispanic population in Missouri. That is much faster than the national rate. The national growth rate for the Hispanic population is 43%, so almost double the national growth rate. The majority of Hispanics, once again, do live in Jackson County, St. Louis County. But compared to African Americans, there is a larger proportion of Hispanics that live in rural areas. So about 20% of Missouri's Hispanic population lives in rural areas compared to only about 8.5% of the African American population. 95 Missouri counties, so 95 out of 115, have at least 100 Hispanic residents, compared to 78 counties that have at least 100 African American residents. So the Hispanic population is more dispersed throughout the state. And actually the county with the highest percentage of Hispanics is Sullivan County. Sullivan County is in southeast Missouri, so northeast Missouri, up north. I do want to point out, and these are combined from the two different data books, these are what is called population pyramids. And typically what you would see in the past with a population pyramid would be most similar to what you see on your left. This is a Hispanic data pyramid for the state of Missouri. On the left side, the pinkish color is female, the blue color is male, because we're gender stereotyping. And what these population pyramids do is, so if you look at the very lowest bar, and I'm going to point to it, this very lowest bar, that is an age category of 0 to 4 years old. And so for females, 0 to 4 year olds make up about 6% of the Hispanic population and about 6% of 0 to 4 year old males. So 0 to 4 year olds in the Hispanic population, about over 12% of the Hispanic population is 0 to 4. Now, if you compare that, the middle pyramid is African Americans. A little over 8% of African Americans are 0 to 4 years old. And then if you go one over from that, that's the white population in Missouri, and only about 6% of the white population is 0 to 4 years old. And so you can see, as you move from the left to the right, you can absolutely, for the white pyramid, see the baby boom generation. So it's that little bulge from the 40 years to 65-year-olds. You see a little bit of the bulge. You can see it with the African Americans and much less with the Hispanics. Overall, the Hispanic population in Missouri is much younger. And what we're starting to see, if we look back at past data books, the Hispanic population in Missouri used to be much more heavily male. And we're starting to see that shift. So there still is more males in that 20 to 35 age range. But for the younger Hispanic population and then older Hispanic population, the gender is split almost evenly between males and females. Income is a really important indicator to look at, and so what I'm doing for these data books is just pulling out some of the most interesting data in the data books. But we wanted to point out some income comparisons because income has a clear tie to both access to healthcare and health literacy. And so what we're seeing with median household income is that whites have the highest median household income. It's almost $48,000 compared to $36,000 for Hispanics and $30,000 for African Americans. Since the last data books, Hispanic income, household income has decreased 1.5%, while white income increased 10% and African American income increased 5%. So we're actually seeing that disparity widen. While it's good that income went up for both whites and Hispanics, it grew much faster for the white population. In fact, African Americans compared to whites, white median income is 55% higher than the African American income in the state of Missouri. Percent of population below poverty level. This increased for both Hispanics and whites, so a 3% increase for Hispanics living below poverty, 2% increase for whites, and there was a slight decrease for African Americans, which is a positive, but you can see that the percent of African Americans living below the poverty level is still more than double that of the white population, and over 30%. Health insurance. So both Hispanics and African Americans are more likely to be uninsured, and higher percentages of uninsured compared to their percentage of the state's population. So looking at census data, there's currently about 876,000 uninsured Missourians. About 71% are white, 18% African American, and about 11.5% are other race or ethnicity. I think it's also important to look at another data set that we used in these data books, looking at ER visits. So if you look at ER visits, 75% of emergency room visits for Hispanic residents are either Medicaid, about 47% are Medicaid, or almost 30% uninsured. 70% of ER visits for African Americans are either Medicaid, which is at 43%, or uninsured at 26%. And that compares to white ER visits, which are at 44% of ER visits for whites are either Medicaid, which is about 29%, or uninsured, which is at 18%. So we're seeing large differences in the rates of uninsured, and this is where I will stop once and talk about the new strategic plan of the Missouri Foundation for Health. So one of our brand new targeted initiatives that a new request for applications was actually just released last Friday. The foundation sees the new opportunities coming forward through the new health insurance exchanges, the health insurance marketplace exchange, same thing, as an opportunity to reduce the number of uninsured in the state. We hope in the future that the state will consider transforming Medicaid, which would include an expansion of the Medicaid program. It didn't happen this legislative session. If that happens, we have set a goal for this initiative. It's called the Expanding Coverage Initiative. We would like to see the uninsured rate. Our goal is to have the uninsured rate in Missouri down to less than 5% in the next 5 years. It's a very ambitious goal. Sometimes my staff throw things at me, but I think we can do it, and I think if we all work together, it is a possibility. So the Expanding Coverage Initiative, what is it focused on now? What is this new request for applications that has come out? So the new health insurance marketplaces that will open October 1st with coverage starting January 1, people are going to be needing assistance to understand these new insurance options, to help them enroll into the insurance options. There is some federal money, if you've heard of the Health Insurance Navigators. So there is some federal grant money that closes. The applications are due June 7th. But we were very disappointed as a foundation in the amount of money the feds put towards that. So it was only $1.3 million for Navigators for the state of Missouri. The foundation's RFA that just was released last week will be funding certified application counselors. That is what the feds refer to as volunteers. And what they mean by volunteers is that they're not paid for with public dollars, but they can be paid for with private dollars. So the RFA we have released is $5 million for certified application counselors in the state of Missouri to help assist people enrolling into insurance coverage. And if you're interested in checking that out, it is on the homepage of our main website. Education and employment. We actually are seeing some gains for African Americans and whites when it comes to the percent of residents with a high school diploma. We saw an increase of 3% for both of those populations. Unfortunately, we did see a decreased rate for Hispanics of 1.3%, when it comes to high school graduation. Unemployment rates, not surprisingly, since the last data book, the unemployment rate did increase for all three groups. For Hispanics, it increased 3%, for whites, increased 5.4%, and for African Americans, 2.6%. So while African Americans were hit less hard by the most recent recession, you can see that African Americans have more than a double unemployment rate compared to whites. And so currently African American unemployment in Missouri is at about 20%. One of the new sections of the data book includes some information about unhealthy behaviors such as smoking and not getting exercise. You can see that for smoking, the populations, African American, white, Hispanic, have very similar rates in 22 to 25% range for smoking. But I do want to point out that compared to the national rate, Missouri is just much higher than the national rate for smoking. So the national smoking rate is about 19%. So all three of these populations have percentages of smokers much higher than the U.S. national rate. There is a statistically significant difference for no physical activity, no leisure time physical activity. If you compare African Americans and whites, it's about 29% of African Americans compared to 23% of whites. Smoking and not getting physical activity, there are multiple factors that really lead into these unhealthy behaviors. And so a lot of times I often out in the community, and I'm out there a lot talking about different health topics, hear a lot about personal responsibility and that we have to take personal responsibility for our health behaviors. And there is I agree with that to a certain extent. However, I think we need to look more closely at what are some of the reasons and factors that really lead to higher smoking rates, less ability to exercise. And there really are multiple factors that lead into that, including the safety of people to get out of their homes and go walk in their neighborhoods. Stress. So if you're working multiple jobs or you work a job that is during the evening or overnight, it's more difficult to get out and exercise. Work stress, the stress of facing discrimination on a daily basis and how we cope with that type of discrimination. These are all things that contribute to making unhealthy choices to cope with our daily stressors. And so one of our jobs in public health is to really provide people with the tools for, one, trying to help at a systemic level eliminate some of those stressors, and then on an individual level, helping people have the tools to deal with stress in a healthy way versus an unhealthy way. I pulled this out because I found it very interesting, and I think it translates later to some of the death rates and some of the diagnosis rates that we see. This is screenings, and we do see some disparities when it comes to colorectal cancer, but we don't see the same disparities for African Americans and whites when we look at breast cancer screening or cervical cancer screening. In fact, African Americans fare quite a bit better compared to whites for screenings. Now, there is a disparity for breast cancer screening for Hispanic women, but what this doesn't translate into, this more screenings and African American women engaging in screenings, it doesn't translate into access if something is identified in that screening. And so we see higher death rates for African American breast cancer, so there's a disconnect here. While we're doing something right in getting minority populations to access some of these screenings, there's a disconnect between accessing a screening and being able to access care after receiving that screening if a problem is found. Some chronic disease risk factors, I think this ties back exactly to those smoking rates that we saw and a lack of physical exercise and eating healthy. You can see for hypertension, which is high blood pressure, there is a disparity for African Americans compared to whites. That disparity isn't there for Hispanics, and that's mostly because the Hispanic population is much younger, a much younger population. What's very concerning is even though Hispanics are a much younger population, we see a pretty large disparity for high cholesterol among the Hispanic population. So 54% of the Hispanic population has a diagnosis of high cholesterol. And then you can see the obesity rate, a smaller obesity rate compared to whites for Hispanics, but African Americans, currently over 40% of African Americans in the state are obese. I'll stop here again because one of our other new initiatives in our strategic plan for the foundation is focused on childhood obesity. And so we have focused on obesity, if you're familiar with the foundation, for many years. We are specifically now going to target childhood obesity, and we're doing that through schools. So we are currently developing partnerships with schools around the state. We're going to start out in 10 schools and then slowly over a 5-year period expand working with more schools. That doesn't mean that we're only working with schools. We are also going to be working with community partners. And so there will be opportunities for public health organizations in communities to work closely with their school districts and with the foundation in trying to address some of the disparities we see around obesity. Yes.
Can all of this data, do you all have it broken down by gender?
We don't. So there is, I think, for the first time in the data books, there are some charts that do have gender broken out, but for most of the data, it is not broken out by gender. Somebody from the state may be here. I think on MICA you can break things out by gender for some indicators. I don't think it's for all indicators. Rashmi's nodding her head. Yeah. So I would say if you are interested in learning how to do that, can they talk to you? So yes, there is ways to do that with MICA. Next slide, maternal and child health. So we see some significant differences between African Americans and whites on indicators related to maternal and child health. Inadequate prenatal care, almost 2 to 1. Infant death, 2.5 to 1. Low birth weight, 2 to 1. So the foundation also had some strong concerns about infant mortality. And so once again, one of our new strategic items is we have a new initiative focused on infant mortality in Missouri. Now, we are trying something slightly different with this. Our board has been playing around with the idea of place-based funding for several years. And really, we were looking, there's a foundation in California that went completely to place-based funding. We didn't want to do that. But when we really started investigating infant mortality, we started to see that there were some hot spots in the state of Missouri. And so the new initiative that we have focused on infant mortality will focus on 2 areas of the state. So one is North St. Louis, and the other is the Boot Heel. And so this afternoon, one of our board members, Cynthia Dean, who's from the Boot Heel and works on this exact issue, is on the panel this afternoon, and she's much more of an expert than I am on that. But we really saw this as an opportunity to see those hot spots and see if we could really start addressing those issues in different ways. And North St. Louis City compared to the Boot Heel are very different places. And so the strategies will be very different in those 2 locations. But we thought it was important to really try to go down in the weeds and start addressing some of those hot spots, and thought this was a great health issue to really use to first try that out. You can see there is a spike in the data, and I forgot to go back and look and see if that recent spike was due to that they calculated it differently, or if that truly was a spike. It looks like it's so similar for all 3 groups that it may be a change in the way the data was calculated. But you can see there's some fluctuation and this is for inadequate prenatal care, but that disparity just persists. And this goes back all the way to 2001. And so we're not seeing a lot of movement. And this was one of the reasons the foundation really looked at this and said, yeah, there's a little bit of fluctuation, but this is a persistent problem. And we really want to try to tackle those issues where we're not seeing a lot of progress. Infant death is another one where huge disparities, and this is for some of the data in the African American data book, and I really wanted to throw this up as an example. We aren't able to do this with the Hispanic data, but with African American data, for certain indicators, we can pull it out at the county level. And so you can see huge differences. While we often can talk about the state rate, if you break it down by county, you can see big differences between counties. And so Greene County, which is Springfield in this, on the left side, the infant death rate for whites is about 6.2 compared to African Americans, which is almost 28. And so it's more than almost a 5 times higher rate for African Americans for infant death. One of the biggest places where we see the greatest disparities is communicable diseases. And while we've seen some progress in communicable diseases since the last data book, such as tuberculosis, we actually saw a huge decrease for both African Americans and whites with tuberculosis. We're seeing increases for other indicators. Also in Missouri, talking about sexually transmitted infections, communicable diseases, is often a little bit controversial, but it's something we need to talk about. This is a huge public health concern for the community. Why do these disparities exist? A lot of it is access to primary care. It is also education about sexually transmitted infections, communicable diseases, giving our young people the knowledge to protect themselves. Shouldn't be controversial. It should be a public health issue that we all care about. Unfortunately, we are starting to see the HIV infection rate. From the last data book, it was 8-to-1. It is now 9-to-1, so we're starting to see HIV infections go back up. Chlamydia, we have seen increases for both African Americans and whites. The chlamydia rates are particularly high in the St. Louis and Kansas City areas. And you can see the disparity is just, if we really made those bars proportionate, the white bar would be like this big compared to that African American bar. The rates really are unacceptable. And if we look at AIDS case diagnoses rates, so this is, you've been infected with HIV, and when you have an AIDS diagnosis, it really has to do with your T cells and your immune system. We're seeing an increase in the rate of AIDS case diagnoses for African Americans, a slight increase for whites, but a statistically significant increase from 7.7 per 100,000 to 10.8. And so some of that has to do, I think, with people not getting access to care, not knowing that they're infected until the disease is very well progressed. There is more and more of a belief among young people that HIV and AIDS is a manageable chronic disease, and I think that's something that we need to stop perpetuating. Yes, it is manageable for many people, but it's a very strict regimen, and there are a lot of side effects for the medications, and it's a very strict protocol to really keep HIV under control. Gonorrhea, we have seen a decrease in gonorrhea rates, which is good, but at the same time, there is still this huge, major disparity for gonorrhea in the state of Missouri. Emergency room visits, and this is really where we start to see that translation from some of the indicators we see around prevention and the disparities we see in prevention and access really showing up in the emergency room, and disparities related to health insurance. And so you can see some pretty major health disparities for African Americans compared to whites. Now, Hispanics did have lower rates of ER visits compared to whites for all indicators. But some of that has to do with, yes, they're a younger population. It also has to do with fear around accessing the emergency room and deportation, and a lot of the rhetoric we're hearing around immigration policy in the United States and Missouri. Mental health. So this is one of those things we did see increases for African Americans and whites, actually a much higher increase for whites from 2001 to 2010, but significant for both populations. Part of the increases in mental health, ER visits, some of it has to relate to the economy. So when the economy tanks, we see more stress among families and individuals, and that increases mental health concerns and people accessing ER services. During that time period, we also saw reductions to Medicaid eligibility, which had an impact on parents. And so when you don't have health insurance, one, that's another stressor, and two, you really don't have a lot of options for trying to engage in primary care access and wait until a mental health condition gets so bad that you have to visit the ER. Another big area of concern is asthma, and once again, I pulled this out by county. just to show the huge disparities, especially in St. Louis. You can see the disparity for asthma-related ER visits. Once again, this really has to do with access to preventative care, primary care, education in terms of teaching families about how to keep asthma under control. This is one of those indicators that, from a public health standpoint, really starts to get into the issue of housing and the type of housing and that we have. And so when we start talking in the policy shop about social determinants of health, you have to start talking about things like transportation and housing and safe neighborhoods. And this is one of those health issues that really plays that conversation out. Just ER visits for high blood pressure, and you can see remained relatively steady for the white population, but we have seen a pretty significant increase since 2001 among African Americans. And I'm running out of time, so I'm going to scoot through these. I wanted to show the firearm assault is one of the, other than the communicable diseases, firearm assault is one of those indicators that has one of the greatest disparities. So about a 35-to-1 for firearm assault. For some of these other injuries treated in hospitals, bike injuries, males are 3 to 4 more times higher than females for bike injuries. Both African American and white women are 3 times more likely to have physical abuse injuries, and the majority of the sexual abuse injuries treated in the hospital are children. So I really think this gives us some, we need to start talking about some of these issues and finding solutions for some of these injuries that are preventable. Leading causes of death, and this is where it gets a little difficult for the Hispanic population. We do have leading causes of death for both populations. You can see for African Americans, it's heart disease, cancer, stroke, unintentional injury, and homicide. Very similar for the Hispanic population. Unintentional injury is a little higher, and diabetes is on the list in the top 5 for Hispanics. Leading causes of death, when you compare African Americans and whites, the death rates fell. So good news, the death rates fell for both groups for heart disease, cancer, stroke, and diabetes over from 2006 to or from the last data book to this, so from 2001 to 2010. However, death rates increased for both groups for kidney disease, chronic lower respiratory disease. Unintentional injury deaths went up for whites, and we'll talk about that in the next slide, and down for African Americans. And the homicide death rate went up for African Americans and stayed the same for whites. So that accidental injury indicator, really interesting stuff. The disparity has almost completely disappeared. However, the reason is, yes, we're seeing quite a bit of a decrease for African American males when it comes to accidental drug poisonings. But since 2001, that rate for white males has just gone up and up and up and up year after year. So what is accidental drug poisonings? Most of this has to do with medications. So the increases we're seeing in especially young people accessing prescription drugs and using them inappropriately. And we're seeing major increases, especially among the white population. I did also want to show that, as one of the questions was, does some of this data break down by gender? For certain indicators, we did do that, and I think it's important to point out for HIV/AIDS death rates. One, I broke this out to show the huge discrepancy between whites and African Americans, but also to show the difference between white males, African American males, and we often think, I think it is a stereotype myth, that HIV and AIDS is a white male disease. And I know that perception has changed, and most public health professionals understand that that's not true. But even if you compare the rate for white males compared to African American females, the rate for African American females is double that of white males in the state of Missouri. The last graph on the right, PMR is proportionate mortality ratios. There's an explanation of that in the data books. It is what we use for death rates for Hispanics because the Hispanic death rates, the data is not good enough to calculate those death rates. So we use what is called a PMR, and it's really a ratio of sort of white death rates to Hispanic and African American for a certain condition. And so you can see those PMRs for some of the leading causes of Hispanic death. And you can see mostly here for Hispanics, lower PMRs compared to the white population, except for stroke and diabetes is especially concerning, considering the young Hispanic population. It's almost double. Diabetes deaths are almost double that of whites. We also can break things out by specific types of cancer, and we start to really zero in on what are some of the major issues. And you can see for the Hispanic population, also for African Americans, liver and stomach cancer really jump out at you in terms of disparities that exist in terms of causes of death. And that is it. I think I hit my time perfectly. So we will take questions after Shannon has a chance to talk. So thank you.